action.
And action.
Welcome back to Empowerment Nursing. Today we are talking about what are you waiting for? 5 things you can do today to pass your registration exam.
And just a little housekeeping stuff as we always do before we get started. If you have any questions about Empowerment Nursing, who are we, what do we do, what are we here for, you can visit our website. It's www.n-powermentnursing.com. Please join and subscribe to our Facebook page. We frequently publish blog posts, Facebook Live videos such as this one, test questions regularly, very positive learning environment. So please subscribe to our Facebook page. You can press subscribe to this video and you'll actually be notified anytime we do a live Facebook video. Any comments you have, please comment below and let us know where it is you're watching from, because we love to know who it is we're reaching. Let us know your name, where it is you're from. Please share this video. It's really important to us that you share this video because that is how we reach other people and help support them through this struggle. And so just, let us know where you're from and we'll get started with all that being said.
Barack Obama came to Canada recently and he said the following words: "Progress is never inevitable. It is often fragile and it is always in need of renewal." And his words just hit me as I thought about those words and applied them to the journey that Ashley and I are engaged with in terms of passing this registration exam. When you think of those words and apply them to studying, studying is never inevitable, it is often fragile and in constant need of renewal. And this is important when you think about what steps that you can take right now to pass this registration exam. The bottom line really is that this exam is hard work, and embracing that hard work and readying yourself for that hard work like you would do with anything in your life. Whatever goal you're trying to reach takes hard work. And you have to find your courage. You have to let go of your shame, whatever shame might be lingering. Anything that's going to come in the way of your goal. Having a definitive moment of decision that you're going to work hard and move forward.
Tip number 2 would be that, let's just say it out loud. You cannot pass this registration exam without engaging in the content. The good news is that we've done all the content for you. Our course is complete with all of the content, but you cannot not study the content and expect to be successful. And this is evidenced by any prioritization question, which is frequent that you might come into on the NCLEX, the nclex-pn, or the CPNRE. You're always going to have prioritization questions that are going to ask you which patient is most ill, which patient deserves your attention first, which do you need to assess first, what do you need to do right now. So if they give you 4 patients, say for example with a diagnosis of congestive heart failure, COPD, a fresh post-operative patient, and somebody with diabetes, you're going to have to know all of the pathophysiology behind those diseases, all of the signs and symptoms of those diseases, what red flags might be raised in terms of those diseases, and who would be the sickest. And so if you don't know that content, you don't stand a chance besides luck, right? Getting the right answer on your registration exam if you do not study the content. Yes, test questions are wonderful. We regularly post test questions, but test questions are not studying. Test questions test your content knowledge. That content needs to come first, so there's nothing fun about it. It's hard work. It's difficult to memorize and know this entire textbook, but it's something that you have to do. Content is required.
Number 3, recognize that often the only person stopping you from success is you. Become aware of whose responsibility is it to pass this registration exam. We can blame other people, we can blame other things, we can blame other institutions, but when it really comes down to it, the work is yours. It is your responsibility to pass.
Number 4, You have to make a commitment. You have to decide that you are so invested in this. You've put in the years of your education. You've graduated from nursing. You've done your clinical rotations. You've written those journals. You've passed those pharmacology exams. You have so much success to celebrate right now. You've come so far. You can't let that last little hoop that you have to jump through prevent you from finishing that goal, from crossing that finish line, from achieving that title of nurse. But that's going to take a commitment to do whatever it takes to make that happen. Maybe you're working a full-time job. Maybe you're raising 3 kids. Maybe you have help. Maybe you don't. But what type of sacrifice? And remember, this is a temporary sacrifice. You're not going to have to study forever, right? You're going to have to hunker down on that 4 weeks, that 6 weeks, depending on your schedule of full-time studying. But you're going to have to make the decision to commit to that. We've had different graduates come through our program who have been unsuccessful 4, 5, 6, 7 times, who come to us with not the excuse, but with saying, and it's a valid concern, I work full time. Listen, I gotta pay my bills. I gotta pay my rent. I gotta pay the insurance on my motorcycle. I can't just quit my job and devote my time to studying. I have all of these bills to pay. And one student in particular stands out to me because the sacrifice that he had to make in order to succeed was taking his motorcycle off the road for 4 weeks, shutting off the insurance on that motorcycle. We've had people that needed to move in with supportive people, right? Call on those people in your life that you can rely upon for 4 weeks. You are going to have to make a commitment and make sacrifices in order to make that happen.
And number 5, the most important action you can take is greater engagement in this act of studying, which means greater engagement in yourself, greater investment in yourself. The longer and farther we get away from studying, the greater the mountain looms. It's like it grows. That anxiety and fear about this goal grows the farther you get away from it. If you are facing in the right direction, all you have to do is keep walking. Walk back towards that mountain, face that fear, and get engaged.
You may have thought this evening, giving the title of our Facebook Live, that we were going to give you 5 physical actions, 5 practical actions. So how about we get out a piece of paper and a pen and we write down everything we know about diabetes or whatever disease process it is, or you're going to make a study plan, you're going to do this. But the hard truth and the reality is that the physical action of studying and getting down to it cannot happen unless you do those 5 things, unless you realize that it's going to take hard work. You got to put in the effort if you're going to succeed. Realize that you're going to have to study content. I know nobody likes to do it. Certainly I didn't like to do it, but that's what's going to happen. You're going to have to realize that you are the person that's responsible for your success, and regardless of anything that comes into play, at the end of the day, you're the only person that can climb that mountain, and overcome that, committing to the goal and then engaging in the goal. So maybe I'm talking right to you, whoever out there this video reaches. Maybe you have totally forfeited your place in this profession. Maybe you've already decided that a nurse is just something that you're never going to be, and you have a diploma or a degree and it's just going to end there, right? Maybe every day that passes for you is just another day that you're not a nurse. And we say that with the utmost sympathy because we've experienced that firsthand. We've sat down with graduates who feel so defeated, who are letting this exam run their lives, who are letting this impact their relationships, their everyday life, and most importantly, their self-worth. And we're here to tell you that it doesn't need to be that way. If you can figure out what it is that's stopping you, if we can help you figure out what it is that's stopping you, only then can you overcome that.
And we'd like to end with our t-shirts on
Our
here.
t-shirts, because as Nightingale says, and as we firmly believe, we should rejoice in one another's successes as our own, and mourn in one another's failures, as our own, because at the end of the day, We are all one
nurse.
nurse.
Don't give up.
Don't give up.
Don't give up.
We're here for you guys. John has to come and press the button. That awkward moment when you're waiting for the live video to end.